Is making his health care overhaul a top priority, and Bruce, as he had hoped, he's gotten some quick action on the plan.
And he has a deadline for getting the Congress to act before their August recess. A Senate panel has passed a $600 billion health care reform plan one day after House leaders put forward their $1.2 trillion proposal. It aims to cover uninsured individuals and control costs. The massive scale of this plan has a lot of lawmakers scrambling, while the White House is actively pushing for an August completion date, as I mentioned. Joe Krier is the president of Krier Wealth Management, here to discuss what's being proposed, what it means to us. So let's talk about this dichotomy that exists first. You know, they say they want to go ahead and they want to cover the uninsured and cut costs at the same time. Can you do both?
It would be pretty difficult, you know, and they're not going to necessarily give insurance to all the uninsured. They're going to force some of them to pay for the coverage. They're going to force employers to offer coverage, or there'll be a penalty, and then there is going to be subsidies for some of the uninsured out there. The cost-cutting part, that's a big debate that's going to take 5 years to figure out whether it really works or not.
Let's talk about some of the key points of this plan, because it's massive, and the American public just doesn't really understand a lot of what's going on, me included.
Yeah, I mean, if you look at Medicare and Medicaid, what this essentially does is expand Medicare and Medicaid to cover the entire population. And what the feds are doing is to set up their own plan to compete with private insurers. And the idea is that an individual can go to a website or an insurance exchange and sit there and say, okay, here's the government's plan, here's the one I have, which one offers me better benefits. The idea is that the competitive nature of that brings things down. The other part here is centralized data collection. Two parts to that. One is for individuals to have all medical records in one place, and there's been a few private companies trying to do this for years. They've just had a hard time assembling it, so that if you're on vacation and you get hurt in California, they can instantly check out your records, you know, right here at home. The other part is treatments, where they want to have a centralized database to be able to compare everybody's work on various types of illnesses, viruses, etc., to see what is being most effective and sort of centralize the therapy treatment side of things.
You know, it's interesting because the NIH just 2 days ago gave UF Shands part of a $26 million grant to look at ways to better coordinate patient care. So the healthcare system is anticipating that there are going to be some changes, maybe that included. Let's talk about President Obama's wishes. If he gets his wish, what kind of impact does he want this health plan to have on you and me?
That's a pretty wide open question. I mean, you know, his idea in his mind, and when I poll different people on this, they have varying degrees of cynicism and support on it. But his idea is to provide health care to people that are in a job-changing situation. You know, the old days, people stayed in jobs for 10 years. Now it's something like a 3-year average. And, you know, they're losing care every time they switch jobs. If someone has a pre-existing condition, by law, they have to be covered. The net effect of that is raising the cost for everybody, because they do have to spread the cost of that. And, of course, give us better choices. And they want to penalize employers who don't offer their employees coverage.
All right, now here's the sticking point. How do you pay for this?
Good question, you know, and the two pieces of paying for this. One is a tax. They're looking to tax households that make more than $1 million, 5.4%. They're looking to penalize those businesses that I talked about, 8%, if they don't offer it. And then the other side of it, where the big debate is, they expect to lower costs enough to just cover the cost of the plan by reduced costs and savings along the other side of it.
Look at the Joe Krier crystal ball. They tried in '86 and failed. The Clinton administration tried and failed in 1992 to bring about health care reform. This has yet to go to committee and to find some sort of a hybrid between the House and the Senate. Chances for us seeing health care reform in 2009, 2010?
I think it's pretty good, because you do have a majority in Congress, as well as the White House being Democratic at this point. So part one of your question is, does it go through? Well, if the House is at $600 billion and the Senate's at $1.2 trillion, maybe we end up with a $900 billion bill, and it does get through with a lot of changes, maybe some pork in there to get some extra votes. And then part two is, does it actually work? And that's part of why they're pushing this through right at the beginning of the Obama administration, because they may say, hey, if we can get this through right now, it gives it 2, 3, 4 years to have a chance to take hold before the next round of elections come up.
Clock is ticking.
Joe
Krier, appreciate your perspective.